So this video is about drug therapy, and the following are categories of drugs used to treat specific psychiatric disorders, and this table shows types of drugs. But anyways, I won't dwell on this for too long because it's all on the next page. So the first part is anti-anxiety and anti-panic agents. These drugs lessen anxiety, tension, and agitation, especially when they are associated with panic attacks. Examples are benzodiazepines, which act rapidly as anti-anxiety agents, sedatives, or anticonvulsants. Benzodiazepines directly affect the brain to stabilize the transmission of excitatory nerve impulses. Other anti-anxiety and anti-panic agents are selective serotonin uptake inhibitors, known as SSRIs. These agents prevent the reuptake of serotonin, which is a neurotransmitter, into nerve endings, allowing it to linger in the space between it and the next nerve cell. Next are antidepressants. These drugs gradually reverse depression and return the patient to a more even state, with less persistent and less severe depressive symptoms. The basic cause of depression is thought to be related to neurotransmitters in the brain. Several groups of drugs are used as antidepressants. These include, number 1, which are SSRIs, or selective serotonin reuptake inhibitors, such as Prozac, Paxil, and Zoloft. They improve mood, mental concentration, physical activity, and sleep patterns. The next one is SNRIs, which are serotonin norepinephrine reuptake inhibitors, which are antidepressant drugs that modulate the two neurotransmitters serotonin and norepinephrine in the brain. Examples are Effexor, Pristiq, and duloxetine. Other antidepressants that do not fit into defined categories are bupropion and trazodone. The next are tricyclic antidepressants. These drugs contain 3 fused rings in the chemical structure, hence the designation tricyclic. The TCAs restore the balance of neurotransmitters in the brain to relieve depression. The next are monoamine oxidase inhibitors. These drugs suppress an enzyme, monoamine oxidase, that normally breaks down neurotransmitters. MAO inhibitors are not as widely prescribed as other antidepressants because serious cardiovascular and liver complications can occur with their use. Significant dietary restrictions are also necessary to avoid adverse reactions. Next are anti-obsessive compulsive disorder agents. These drugs are prescribed to release the symptoms of OCD. Tricyclic antidepressants and SSRIs are examples of these agents. Next are antipsychotics or neuroleptics. These drugs suppress psychotic symptoms and behavior. Atypical antipsychotics are the major examples. They are used to treat schizophrenia, bipolar disorder, and other mental illnesses. They reduce anxiety, tension, agitation, and aggressiveness, and modify psychotic symptoms such as delusions and hallucinations. Older drugs, such as the first generation of antipsychotics, like phenothiazines, are still used as well. An important potential adverse effect of older neuroleptic drugs taken over long periods is known as tardive dyskinesia. Tardive means late, and dyskinesias are abnormal movements. This is a potentially irreversible condition marked by involuntary movements. Early detection is important. The AIMS, also known as Abnormal Involuntary Movement Scale, is used to monitor patients for signs of TD. And that's about it for this video.